All right, well, welcome back to Anatomy and Physiology for Speech and Hearing. My name is Shanna Stack, and I have the privilege of delivering Chapter 6, Part 1 and 2 for you guys this week. So I have had the opportunity to teach this class for 3 years before this one. Originally, I taught it alongside Dr. Yanovitz, where he taught the physiology portion, I taught the anatomy portion, and then kind of quickly moved into teaching athletes. So I'm excited that I get to be a part of your guys' class. Here's some links for you guys that are embedded within the lecture. I just like to. So we're going to talk about articulation. And articulation is really when two joints or any processes are moving together. Okay, so if I have my index fingers and I put them together and move them, they're articulating against one another. Okay, so I can articulate my humerus, which is this part of my arm, against my scapula and my clavicle here. Okay, so that's articulation. I can articulate my mandible with my temporal bone. In this case, there's a process called the condylar process right back here that actually articulates with the cranial skull. And I'm going to use this skull, and I'm not sure how well the camera picks up on it, so I'm not going to depend on it. But you can get one of these on dickflip.com. They're about $30. And I'm a big fan of trying to incorporate as many modalities for learning. And so going with something hands-on is super helpful for me and for many of my students. I didn't give any background. I have a biology undergrad, so I have a BA in human biology. And I lost one of my teeth from my skull. Hold on. Got it. Sorry. And I just finished the Masters of Communicative Sciences and Disorders. So I'm currently working as a speech pathologist and a clinical fellow, which means I'm still being partially supervised up in Ronan. So I have one job at the hospital, and I get to do some really fun things, modified bariatric swallow studies, which you guys will probably learn about a little bit, especially when you get to grad school. So I get basically I could go to radiology and hang out with doctors and really smart people and look at x-rays of people swallowing. It's really fun. And I work in a nursing home. I do inpatient there, and then I also work for a Head Start program, and I see babies 0 to 3. So I see the whole lifespan. So it's really an interesting job, and you're not going to get bored in a position like that. So it's super duper fun. So anyway, that's a little history on me. All right, so back to our slide. I just didn't want you guys to wonder who this lady was. All right, so the articulatory system, when we're talking about the articulatory system, we're talking about it in terms of our ability to make speech sounds. So together we have 11 mobile and immobile. So total we have 11 articulators within this system we call the articulatory system. And so I'm going to list those out for you. And then we're going to go through the bones of the cranial skull, and many of those are going to be, at least in this lecture, many of those are going to be listed. Those mobile and immobile articulators are going to be covered. And then the next section, we'll start talking about some of the muscles and soft tissue and so forth that play a role in that articulatory system. So this lecture is not going to cover all 11 of those articulators. Plus, we're going to go over the cranial skull, which isn't really a big component of articulation, but it's still an important part of our field. So this is a side of this that I think is important to talk about in terms from a pathological perspective, from when patients have something going wrong with their articulatory system. It's very adaptable. Okay, so I just want to, but some parts of this system are more adaptable than others. Okay, so this bite block example is if you bite your teeth together, and here I want you to say your favorite color, and you can do that to your classmate or your loved one, whoever's around. So I'm going to say my favorite color, green. Okay, and you guys should have heard green. Now, if I say the funniest food to put in a sandwich, Russell. Oh, hold on. You got to bite your tongue first. Sorry, bite your tongue. Russell, well, and it's a little bit harder to understand what I said. So I said Brussels sprouts. But if I said Brussels sprouts just by biting my teeth together, Brussels sprouts. It's much easier. So some articulators are a little bit more important in terms of speech intelligibility, in terms of producing speech that's easy to understand. And your tongue is your primary articulator. So if you take that out of the equation, it's much harder to make speech sounds that other people can interpret as forming that language or that speech that helps deliver the language. Okay, all right, so here is our fancy list, and there's the 11. I'm going to break them down into mobile and immobile for you. So we have 3 immobile. One is our hard palate, and you can actually rub your tongue on your hard palate. Okay, and the next one is your upper jaw, your maxilla, right here. And then your teeth, both your upper and lower teeth, okay, are immobile articulators. And I put your maxilla as your let me get it for you. So you're specifically, when I put maxilla, I was talking about your alveolar ridge. And you guys might have heard this if you took some additional classes in CSC, but that's this portion right here. It's that ridge right behind the teeth in your upper dental arch, right here. Okay, and I should orient you. This is the anterior, okay? This is posterior. And basically, this is, not basically, it is a mid-sagittal view of a human body. Okay, so basically, we've cut the body in half, and then we're looking sideways. Okay, so just so you have some orientation, this is the nasal cavity. This is the oral cavity. This is the tongue. Okay. Here's the faucet to the pharynx, but it's the pharynx, the top. Just think of the upper part of the throat. And throat and pharynx are pretty much the same thing. This is all pharynx here, okay? This is larynx, the level of the vocal folds. Then we get to trachea. Well, actually, it's a little bit lower. This is all larynx. Trachea, esophagus, cranial cavity, vertebral cavity, spinous process of your vertebra, all of these guys are. Body or corpus of your vertebra here, from the mid-sagittal view, intercalated discs here, okay? Hard palate, in your velum or soft palate here, okay? This is your mandible or your lower jaw right here. And here's your hyoid bone. So it helps me with that overview for you guys, but we'll learn it together too, okay? All right, so here's that same picture, and I'm just pointing out the mobile articulators. So remember, we have 3 immobile and then 8 mobile, so total 11. So we have our lips, and I'm a huge kinesthetic person, touch, feel, move kind of learner. So, and when you go to an exam, you can bring your body. So it's an excellent study tool if you add that component to it. So really get familiar with it, okay? So your lips are mobile articulators, your cheeks, your tongue, your mandible, your lower jaw. However, your maxilla is immobile. So mobile, immobile, okay? Your velum or soft palate, right here, is mobile. Your hyoid bone, right here, okay? And then your larynx. All right. All right, now we're going to talk about the difference between, now we're really going to move into talking about facial bones and cranial bones and really start to break down important bony landmarks. So this is kind of when I get to the nitty-gritty of this section. Cranial bones are any bone that comprises the cranial cavity. So let me show you on my skull here. So the cranial cavity houses the brain, right? So any bone in here where the brain would go, or here where the brain would go, is a cranial bone because it comprises the cranial cavity. Any bone that is not a cranial bone is a facial bone. Okay? So the tricky one is this frontal bone. Basically the bone that forms your forehead, right here. This is your frontal bone. It's a part of the cranial it's a part of the cranial bone. It's a cranial bone because it forms the cranial cavity. Okay, This is cranial bone here, or frontal bone. This is frontal bone, okay? And they're cranial bones. So that's the one that most students kind of miss. And when I first took anatomy, I missed it too. So there you go. So here's a picture of all of your facial bones. And then the next picture, so I've outlined, if you look back, outlined in red your facial bones. And then outlined in green your cranial bones. Okay? And here are all of your facial bones listed. And we're going to go through each one independently. And we're starting with the mandible, which is your lower jaw. Okay, remember that's one of those mobile articulators. We're going to begin with the mental synthesis. So I remember that this is my mental region because I think of that, remember that statue? If you guys can remind me who that guy is in the statue. And he's really thinking. And I think while he's thinking, he's using his mental, his brain, and he has his hand on his mental region, which is right here. And a synthesis is when two structures come together, okay? So this is your mental synthesis right here, and you'll see it in the picture. And this is a picture of your mandible pulled away from the cranial skull. Okay, so if I took this part off, and you kind of can, like you can see I just pulled away from the skull. Okay. Next we're going to talk about the ramus. And ramus actually means branch in botany, and it's helpful in this class. So this is the ramus, I'm just coloring it in here for you. It branches off to form two important processes, the condylar process and the sphenoid process. Right here, they're muscle attachments to help that jaw move. So basically this bone right here, the condylar process, articulates with the temporal bone of the cranial skull, and then this one is a muscle attachment, okay, that allows the jaw to close tight, like that. Okay, so the ramus means branch, and it branches off to form those two processes, okay, condylar, coronoid. Okay. You guys have, I'm sure you've all heard of corporal punishment. And corporal punishment is punishment to the body. So corp means body. So corpus here is the body of the mandible. Just like there's the body of the hyoid bone, corpus of the hyoid, corpus of your vertebra. Okay, so this is all corpus. Okay, the angle is where the corpus turns into the ramus, okay? Because remember, here's the ramus, ramus this way. Sounds like somebody's name, ramus. And then body. Okay, so in here is the angle. And that's intuitive, right? And you guys can feel your angle. Okay, so body, so mental synthesis, body, angle, ramus. Okay. All right. So head of the condylar process. So here's the condylar process, and I hope you guys can see this, but it's right here, and it just kind of tucks into the temporal bone, which is right here. I don't know how well. You guys will have to give me some feedback on how well you guys can see that. But this bone articulates with the cranial skull. Okay. And there's the coronoid process, and I used to get condylar and coronoid mixed up, but I just think of the Y. I use the alphabet a lot, so I think of the Y being later in the alphabet. So condylar is more posterior. Remember, posterior is back, anterior is forward. So condylar is this process that's farther back, and then your coronoid is the more anterior process. Okay. And we have the mandibular notch. That's the notch between your condylar process back here, and you can make little, I kind of make little fingers too. So condylar process, coronoid process, and then in between them, if this is on the top of my ramus, in between them is the mandibular notch. Okay? And I think that name's intuitive. And then we have the mylohyoid line, and that's on the internal aspect of the body or the corpus of the mandible. It's actually a muscle attachment for the mylohyoid muscle. It elevates the hyoid bone when it contracts. Okay. All right, now we're going to talk about the maxilla. It is paired just like the mandible. The mandible has two sides and then they come together at the mental synthesis. The maxilla is also a paired bone, okay? So right and left side. And it helps comprise the roof of the mouth, or that hard palate. And the part that forms that hard palate is called the palatine process of the maxilla, okay? So the palatine process of the maxilla makes up the anterior 2/3 of the hard palate, whereas the horizontal plate of the palatine bone, which we're going to learn about later, makes up the posterior 1/3. Okay? So there's two bones that help make up your hard palate. Okay? In addition to helping form the roof of the mouth, and the maxilla also creates a fixture point, right, for your upper dentition. So here's your upper dental ridge, and it also helps form your inferior nasal conchae that we're going to learn about in a little bit. Nasal conchae are bones that help humidify, warm and clean the air when you breathe in through your nose. They're covered by a type of epithelial tissue, which is like if you think of your skin, that's a type of epithelial tissue, but it's like that, but it's really a little bit more delicate and but moist. It's actually called mucosa, and it secretes mucus. That's really nice and wet and helps collect debris and warm the air and humidify it. But the nasal conchae are these kind of bony, kind of mangled-looking structures that when the air comes in, makes the air kind of swirl around. So it keeps the air in there a little bit longer, so it has more time to get cleaned and humidified and warm, which is important to protect your lungs. Okay, so here's an anterior view of your maxilla. It's been dissected away. So you'll see it comes all the way up here, okay? So this is all maxilla. Okay, so you have the zygomatic process here, and that means that this bone is articulating with another facial bone called the zygomatic bone. So you would say that this is the zygomatic process of the maxilla. Okay. This is the frontal process of the maxilla. So it's going to articulate with the frontal bone, which it would be up here, okay? And here's the nasal crest, and then your nasal notch on each side. So nasal crest, nasal notch, zygomatic process of the maxilla. Okay, frontal process. This is the sagittal view, internal sagittal view of the maxilla. Okay. So here is anterior. Okay. So here's your alveolar ridge, and then this is kind of showing how it's going to help form the hard palate. Okay. It's not the most. This is not the best picture. That medial view. All right, so here's another picture of the hard palate. So here's the person's nose, as if they're looking like this. Okay, so here's the palatine process. Okay, all of this. So there, that's the palatine process of the maxilla. Okay, and then this posterior 1/3, it's even kind of like a quarter. Okay, is the horizontal plate of the palatine bone. And you're just going to have to practice that. I would draw out the hard palate and then label it to help you guys remember. All right, so here's a child with cleft palate. So that's when that inner maxillary suture, the suture between the right and the left side of the maxilla did not form that inner maxillary suture, so, which is right here. Okay. All right, and here you'll see the alveolar ridge. You guys can feel that, and this is something that we covered a little bit earlier. right, so the next facial bone we're going to talk about is the nasal bone. It is a tiny little bone, and you guys can feel it right here. Okay, just right at the bridge of your nose. That's your nasal bone. If you move more anteriorly on your nose, that's just cartilage, okay? But this is bone. So you'll see on any skull. This is the nasal bone here. Anything anterior, this is obviously, right? That would be cartilage out here to help form the nose. Okay. The next one we're going to talk about is the palatine bone. Let's look at this picture on the right first because it's one we've seen already. Okay. This is the horizontal side of the palatine bone, and just think of it, it's on the horizon, right? So that's the flat part of the palatine bone. And then you have a perpendicular